There is a trend of late marriages these days, and everything is going late, so it is very difficult to explain them when they are trying for fertility, but actually they are aging, irritability, mood swings, bloating, depression, why the body suddenly is behaving this way. Estrogen is a hormone which affects bones. Bone formation it affects. So when estrogen is not there, so women's bone become very brittle. Menopause is a time that after every woman should take calcium, because now the body does not make it. First, a woman should accept and understand that it is menopause. People don't. It is very difficult for people in India to understand. Jitna easy it is to understand in US, people have accepted it, but in India, it's still a stigma to accept that the menopause has come. Menopause is not an illness. It is just a body change. There is a lot of stigma in taking hormone replacement therapies. That taking these hormone replacement therapies for a long term and unprescribed is not healthy.
RKDF University.
Hi, I'm Shreyasa Vijay and you're watching Ritam. Today we are going to discuss an issue that affects millions of women worldwide, and that is menopause. What is menopause? How does it affect your body? How can you lead a happy and healthy life post-menopause? What kind of tests, supplements or diet should you take? We'll try to cover all these issues in today's episode, and to discuss, today we have with us Dr. Purvi Khandelwal, who is an obstetrician and gynecologist at Sir Gangaram Hospital, New Delhi. Thank you, Purvi, for joining us today.
Hi, Shreyasa.
I would like to start with a very basic question, that what is menopause and why does it happen?
So menopause, as the name itself says, pause of menses, menopause. So when the periods stop for a period of 1 year in a woman's life, we call it menopause. Menopause is a stage in a woman's life which cannot be avoided in any woman's life. But one can prepare themselves mentally by knowing what they are going to face in the future, upcoming, all the signs and symptoms which they are going to face, so they can prepare themselves how to move further.
So at what age does menopause happen? What's the average age range?
So menopause usually occurs at a age range of 45 to 55 years. This is because the hormones which are produced by ovaries in a female body, that is estrogen, progesterone, they start declining from the age of 40 years onwards. So it is not menopause, it is the premenopausal state which affects. So premenopause is the time when female starts having all the symptoms, and it lasts for 1 year after the menopause. Most of the symptoms, patient accustoms with the symptoms, but few symptoms still carry on because the estrogen, which is the main hormone, which is absent now. So it occurs naturally when these hormones subside, but in some women it occurs prematurely when women have undergone hysterectomy or surgery for some ovarian reason. Ovaries have been removed, like for ovarian cancer or something. And some women also have premature ovarian insufficiency. What is that? So premature ovarian insufficiency, when the ovaries stop working before the age of 40. So the hormones come from ovary, and the ovaries have stopped working before the age of 40. So hormones are not there, and the women start having all these symptoms. This usually mostly occurs as genetic causes. It runs in families.
So if your mother or your grandmother is, having
such kind of history early, so one can suspect that even at the age of 35, 38, women come to us these days. They are having all the hot flushes, irregular menses. So it signifies that she might be having a premature menopause.
And we are, even witnessing a trend that women are losing their eggs faster these days.
Yes. So there is a trend of late marriages these days. And everything is going late, so it is very difficult to explain them when they are trying for fertility, but actually they are aging. Their ovaries have actually stopped working and they are facing the issues of menopause.
Alright, so what kind of symptoms do they experience?
Most commonly, menopause presents with irritability, mood swings, bloating, depression, why the body suddenly is behaving this way, night sweats. Suddenly a woman is waking up sweating, all wet with sweat. So they don't understand, they think something is wrong is going in their body. But when they know that it is menopause, which is actually the hormones which have been gone now, so it's affecting their body. Now, what are other symptoms?
Yeah.
From head to toe, it affects our body. Our hair, it lost luster is gone. It becomes so brittle. Skin becomes dry and scaly skin. There is like bone mineral density. Estrogen is a hormone which affects bones. Bone formation it affects. So when estrogen is not there, so women's bone become very brittle. It is very common saying that it is very essential to take calcium in a menopause. Menopause is a time that after every woman should take calcium, because now the body does not make it. It comes from estrogen. Estrogen comes from ovary, and now since it's not coming, so one has to take calcium. So bone loss, cardiovascular risk, one increased chances of heart attacks, high BP, cholesterol increases. All this happens because of loss of estrogen in the body. Yes.
So it means that apart from mood disorder, it also affects your overall long-term
health. From head to toe, each and every part of the body is affected because of menopause.
So say when some women or any woman comes to you with the concerns of menopause, how do you start with them?
First, a woman should accept and understand that it is menopause.
Okay.
It is very difficult for people in India to understand. Jitna easy it is to understand in US, people have accepted it, but in India, it's still a stigma to accept that, oh, the menopause has come. So, because they have learned from the age old that older times female used to have a long, because they used to get married early and long fertility and everything. These days, after 1 or 2 kids, because of late marriages, and the menopause time comes early, so they don't understand that why they are facing all these symptoms so early. So first of all, acceptance and self-care is very important. It is very important to understand the family members, to make them understand and share your problems with the family members as well. What all they are facing, they should understand, and family support is very important in this.
What kind of tests or supplements or treatment do you prescribe to those patients?
So starting with the test and treatment, it is very good that you've asked for test, because menopause, and few people who understand menopause, they say, okay, we know that it's menopause, all this is happening because of menopause. But at the same time, our body requires test also, because this is the time when other problems also start increasing. Our thyroid fluctuates, our body hormone levels, vitamin D, B12, all these things, cholesterol level. So all the baseline investigation, baseline test, ultrasound, everything needs to be done, that nothing is missed out at this time. Lifestyle, which is the most important thing, which has to be changed. Lifestyle modification is the term which I should say. Diet, one should take fresh fruits and vegetables, as it has all the antioxidants and minerals which is most required. But dairy products, digestion has been decreased after a certain age because of the decrease in hormones. Our digestion also, it affects our digestion. So dairy products are not well digested by these women.
So they should totally avoid dairy products?
No, not totally avoid. But if they think that their problems have been increased, they have a mental problem, it affects mentally, that I'm not able to take. So they should understand that now my body is not accepting that. So they should gradually decrease it and take supplements. Other thing which is important is lots of water intake. So the dryness which I'm addressing again and again, they have to take lots of water. Water intake will affect the skin, will affect whole system, cardiovascular system, genital system, the urinary problem. Main problem in women at this age is urinary. They have lots of urinary issues like frequency, they feel like urge to urinate every time, and urinary infection, because they feel like again and again they want to go to washroom, and there's a urinary stasis which causes infection. So if lots of fluid intake is there, so there are less chances of infection in these women. Vaginal creams, hormonal replacement therapies, these are also there.
What is hormonal?
So one should never hesitate to consult a doctor. So if a patient is having lots of mood disorder, anxiety disorder, depression, if a person is going into depression, then one should not hesitate to take hormones. There is a lot of stigma in taking hormone replacement therapies. People think that once started on hormone, their body will be changed and it will harm them. Yes, this is true that taking these hormone replacement therapies for a long term and unprescribed is not healthy, because it also causes there has risk of breast cancer, endometrial cancer, and cardiovascular risk, and if taken for a long duration. But a very low dose of hormone replacement therapies, that is low dose of estrogen and progesterone, which is available in market, and very low dose combination pills for a very long minimal duration of time, which this transition period which I am talking, that mainly 1 year, when it is mainly affecting the women. So one should definitely take it. As well as for the anxiety, one should not hesitate to consult for antidepressants.
Psychologist.
Yeah, one should consult a psychologist. Can take sleeping pills, because yoga, exercise, all these are primary things. One has to focus on yoga, meditation, exercise, light music, and everything. One should try for everything, but if not, then these are the resorts one should not hesitate to take.
So do you prescribe these hormonal replacement therapies to everyone, or should
No. Yes. After trying for everything, if and ruling out that if this patient actually needs the treatment or not, depending on the symptoms.
Okay.
So every woman does not require hormone replacement therapy, but if required, then one should not hesitate to start.
Okay. Are there any alternative or complementary therapies other than these?
See, actually, menopause is not an illness. It is just a body change if one accepts it with open arm. Exercise, meditation, yoga, all this is fair enough to change. Yes, for local problems, like if a woman is having vaginal dryness, so we have vaginal local application creams, which keeps the vagina moist, and the vaginal problems, local problems can be dealt with then. Yeah, systemic problems, if still persists, then hormone replacement therapy.
You were talking about some transitional phase. What are the stages of menopause?
So we have early stage and late stage.
Okay.
So in early stage, when the hormones start declining, the symptoms are not very peak. They have just started in. If one addresses those symptoms at an early stage, well, if one addresses them and start changing their lifestyle initially itself, so it's very good that they may not land up in that stage that they may need a replacement therapy.
Okay.
But sometimes in some women, with doing everything, with all the yoga, exercise, other diet changes, but still the symptoms persist. Late changes, lots of night sweat, hot flushes so much that they feel hot all the time.
Okay.
So the cheeks are red, they feel warmth all the time, lots of sweating, anxiety, lots of depression, anxiety, and cryful mood always. So in those patients, we really need to live.
So apart from doctoral advices and prescriptions or medicines, as a family or as a society, what can we do to support these women?
Normally, what happens at the age of 40-50 in a woman's life? Bacche bade ho gaye, they have gone. Husband is busy in his work. So usually women in our society are left out alone.
Yeah.
So if they prepare themselves in a way, if they make themselves that strong that they are not alone, if they keep themselves engaged in something, so these small problems will not look like a huge mountain to them.
But women do not get that support from family, and they
that's
often
what
it is all in their head. Nothing is happening.
Yeah, it is very important to accept and understand for the women in themselves and for the family. That's why we have run so many awareness programs. We have a menopausal society which is running and conducting awareness programs everywhere, so that awareness for menopause is there.
All right.
And exercise, I'm again emphasizing, it not only gives muscle mass, builds muscle mass, which avoids fractures, but it also makes them move. It lighten up the mood, give them friend circle to be with. So this is good. So they should engage themselves in certain activities, certain group of people, like-minded people, which alleviate all these symptoms.
Alright, so apart from mental and emotional health, does it also affect their sexual health?
Yes, it does affect, because I had talked about vaginal dryness. So the partner, they need to understand, and it has to be if it is talked before about that, yes, we are planning for a sexual activity or something, so we have vaginal creams and lotions available, and there are natural things which can be used, like virgin coconut oil or something that can be used. So, and if it is prepared, pre-informed in the mind, then there are certain vaginal secretions naturally which will come, so that won't be that painful for the woman also. So yes, man has to understand what is menopause, and women should be prepared.
Alright, what other concerns are related to menopause apart from these that women should be aware of?
Bone loss, fractures, easy fractures, which we won't expect in a young woman or a young man, but a old age woman, if she has a twist in leg, then there might be a fracture. Hip bone fracture, these are very common. Then cardiovascular risk, increased risk of heart attacks in these women. So estrogen has a role in preventing cholesterol plaques. So what are cholesterol plaques? They block the vessels in our body. So when the estrogen is less, there are high chances of forming those plaques and high chances of blockage, which might risk into cardiovascular events. So one has to take care of that.
So lastly, Dr. Purvi, I would like you to tell that how can a woman, lead to a healthy and happy life post-menopause? Like what?
Starting with your statement, one should learn to live a healthy and happy life. Happiness is the treatment for everything. Daily yoga, meditation, to like music, one should adapt this in their daily life. Then exercise to build up their muscles, to prevent fractures. Diet modification, which I've already told, and these days this jowar, ragi, bajra, these are also lots of rule. So rather than taking plain atta, one should add all this mixed in nutrition to their diet. Then what else? So vitamin supplements, calcium, daily calcium, vitamin D, vitamin B12. This is usually lacking, and this is actually required for daily life. And hormone replacement therapy if required. Anxiety, to rule out anxiety, antidepressants, sleeping pills if required. These are all the late but early for a happy life, accepting the menopause, and the family and relatives should understand what is menopause.
Alright, thank you so much for talking to us.
Thank
it was
you.
really
Thank
a
you,
pleasure talking to you.
Thank you
So much.